I think the future of health and medicine, whether it's in New Zealand, San Francisco, or Timbuktu, is promising, particularly if you think about not any one technology, but how they come together. If you don't think about where we are in just 2022, which used to be the future, but think like Wayne Gretzky, the famous hockey player, skate to where the puck is going to be in 2025 and 2030 and 2032. And if you have that exponential convergent mindset, we can go from our now, episodic, intermittent, one-size-fits-all sick care that usually happens in the clinic to a future that's much more continuous, personalized, proactive, blended with physical and virtual, much more intelligent and AI enhanced, with better outcomes at lower costs, with better equity for all.
So I've been following Dr. Daniel Kraft's work for a very long time. And each time he does something new and innovative, and it's amazing. But recently I met him a few months ago, and I also found out he's a Kiwi. And knowing this conference theme, Kiwis Can Fly, I was like, 100% we have to get him here. And interestingly, what I also learned is he literally can fly. He is an avid pilot and has served in the Massachusetts and California Air National Guard as an officer and flight surgeon with F-15 and F-16 flight squadrons. So yeah, there you go. He literally fits into this theme. But outside of his amazing activities, what had made me follow his work was that he's a Stanford and Harvard-trained physician, scientist, inventor, entrepreneur, and innovator. He has a long list of accomplishments. He did tell me not to share these with you, but I know he's being modest, and I really think it's worthwhile because he's done some sensational work. He's served as a chair in the XPRIZE Pandemic and Health Alliance Task Force. He's also a faculty chair of medicine at Singularity University since its inception in 2008. He has undergraduate degrees from Brown University and medical school in Stanford. Daniel's board certified in both internal medicine as well as pediatrics. And he was the inaugural class of Aspen Institute Health Innovators Fellowship, as well as he's a member of the Kaufman Fellow Society. He's not done just one, not two, but 4 TED Talks and 2 TED Med Talks. I've watched several of them. I highly recommend going back and watching some of these. He's got multiple scientific publications in some of the best journals in medicine, such as Nature and Science. He's got patents on medical devices, immunology, and stem cell-related stem cells. And Daniel has founded multiple companies, including Internal Medicine, which is focused on personalized, data-driven precision medicine. He's inventor of Marrow Miner, FDA-approved device for minimally invasive harvest of bone marrow. And he's founded Regen Medicine, which enables technologies to enable adult stem cell-based regenerative therapies. So with all of that, one of the more and exciting things, if that's not enough, is that he published research with NASA, and he was finalist in an astronaut selection. So I think that's a really cool career path that could have also been an interesting one for you. And he's won multiple awards, such as the most influential voice in healthcare in 2002, 40 of the smartest people in healthcare, and top 10 internet smart doctors in the world. So with that, I'm super excited to welcome you, Daniel. Thank you for joining us here.
All right. Thanks, Divya. I told you not to read that. My time is up. Thank you. So kia ora, everybody. As you can tell from my accent, I'm a half a Kiwi, but I have roots in, it's not going to work. I need to have the line of sight to the, you can't, yeah, we're going to have to make sure that works. There we go. I have roots in Karori West. Anyone from Karori? Woo! Karori West, Marshall Street, where my mother grew. Oh, no, this is going to be a problem. We need to make sure that I can see that you can see that. That the line of sight goes to the clicker thing. AI is easy, AV is hard. If I move closer, that might work better, but let's see if I can improvise. Here we go. So that's Karori West, where my mother grew up, and there she is in the 1940s, and she actually was born in Austro-European background, but was born in Trieste, Italy, right before the war. And as you might know, it wasn't a good place to be Jewish in 1939. So very luckily, my grandfather there in the middle on the left was an asbestos engineer. The only place in the world that would give him a permit to immigrate out of Europe was New Zealand. So thanks very much. And I've been back to visit 11 Marshall Street when I was last there about 8 years ago with my uncle, Ernie Rosenthal, who still lives in Wellington. He was a teacher at Wellington Boys College. If anyone went to Wellington Boys College, when I was in 8th grade, I got to spend 2 months there wearing a uniform, which was fun. So there I am with Uncle Ernie. My last time visiting, I got to give a talk at Wellington Boys College. And actually got to give a talk at the Beehive to some of the folks there in medicine. So that was my last trip there. I need to get back. It's been a while. And there I am with some member of parliament. And about 20 years ago, I went there. I didn't get to base jump, but I did get to jump off the world's second highest bungee cord jump. What's that called again? Somewhere in Christchurch. And we did the Milford Trek, and there I am with my mom somewhere over Milford. So fond memories of New Zealand. There was my mom with my cousin who lives in Wellington. So I do have some great Kiwi roots, and I'm lucky to be a citizen, and I'm just about to get my passport because if Trump wins again, I'm moving back down there. So we might need to save the family again. So thanks to New Zealand. So I was feeling a little artistic this morning. So I thought, this morning I woke up early, I'd do a little art thinking about the future of medicine. So I did some little sketches, kind of some dystopian pictures of the future of medicine. But I also thought I would try and do some artwork in old style. And of course, actually, I'm a terrible artist. I had a little bit of help making my image here about Kiwis can fly, right? That's my Kiwis can fly image. I didn't really do that by myself. I was cheating. I was using DALL-E, which some of you may have heard about, which is this new crazy ability to do AI-enhanced anything from music to art to even movies soon. And this was some early versions. Kiwis can fly wasn't quite so accurate the first times around. I think it interpreted as actual kiwis, birds, and the fruit. So it got a little better. But my favorite one is this one. Look at that. It's a kiwi and a kiwi flying. So it got better. And I think the one that you could adopt as your next year's logo, I think, is that one. That one I thought was pretty good, right? Not bad. So if you haven't had a chance, try out GPT-3, and there's lots of different platforms, Stable Diffusion and DALL-E, and you can now become an enhanced artist. And that's, I think, just a little bit of a lead into this amazing convergence of technologies that are accelerating and coming together. Let us do new things in new ways, and hopefully can really start to enhance health and biomedicine. And because health is wealth, and without that, we don't have too much. And we have a challenge now to sort of leverage these new technologies from AI and robotics and beyond to sort of make health smarter, more connected, and more intelligent, and hopefully much more accessible and equitable around the planet, from Auckland to Rwanda. And so thematically, what I'm going to try and cover in 30 minutes or so, I'm going to go fast, sorry, I'm going to go really fast, is how technology is accelerating and how we can use some of these new tools to sort of rethink and reimagine healthcare from where it is kind of today to where it could go next into the not so distant future. As mentioned, I have a few TED Talks. I gave one about 11 years ago now about the future of medicine. There's an app for that. That was back when there were only about 20,000 health-related apps. And the theme of that talk was really how technology is getting faster, better, cheaper, kind of super converging and enabling us to do things differently at that sort of interface. Just like, all of us have seen many fields get disrupted at this convergence of technology, how we do our digital banking, how we do digital movies. And of course, we've all experienced a kind of a horrible disruption over the last almost 3 years with the pandemic. And thematically, the pandemic has had a lot of dark sides, but it's kind of opened our eyes to that, many fields have reached that fourth industrial age. Health and medicine is still stuck a bit in the third or even the second industrial age. And so COVID's been a bit of a catalyst to make our industries and ourselves in some ways move faster than we might have in the past. And so if you put on your optimist hat, it's been a catalyst. Just like Sputnik set off the space age, COVID has sparked a bit of a new health age. And hopefully we can take some of that energy and innovation forward. And 10 years after that other TED Talk, I gave a talk last year, how COVID transformed the future of medicine, which when I looked at both of them gave me the idea of how do we look back 10 years ago, where were we, where are we now, and where might we go next in the next 10 years across health and biomedicine? So I'll ask you to think, what do you think about when you think of the future of medicine or medicine today? Do you think about the four walls of a hospital? Because we're increasingly going from hospital to sort of homspital. Where care happens is moving into different places. We're sort of leveraging technology in new ways. What used to require a whole clinic can be done on a wearable device, for example. We're now in an era where we're going from lab to laptop and how we've done research, particularly in the COVID era, or laboratories moving to chips. So there's a lot of change that's happening, but we're still sometimes stuck in our old ways, back to the future modalities. As mentioned, I went to medical school at Stanford. I did my training in Boston, after that Mass General Hospital. When I go back and visit Mass General Hospital, where I was an intern 20-something years ago, there I am in the middle. I know I haven't changed. I have a little PTSD when I visit the ward where I was a brand new doctor, because it's literally unchanged in 20 years, right? You have the same nurses, some of the same patients. The only difference is the young doctor has to type their medical record, but we used to handwrite ours. And they're still using the cutting edge medical communication tool of our day, the fax machine, right? And we're still using paper forms. And even when I had a study done at Stanford about a year ago, how did I get my results? On a CD-ROM with my name written on it. I don't even own a CD-ROM player anymore. I had to go borrow my neighbor's. So we're still sometimes stuck in modalities of the past, right? We're still using public health measures from 110 years ago, right? We're still in waiting rooms. We're still kind of siloing our information in ways that makes it difficult to communicate, and defining our health industries and startups and biopharma and industries in old ways, when we're not really able to define medicine now by body parts, but we're now in this sort of genomic, multi-omic connected age. So lots of opportunities to now think things differently and connect the dots. So part of that challenge is a bit of a mindset one. So what we don't really practice today in medicine, and how many folks here in healthcare? We have a few. A bunch of you are. Okay, dangerous audience, right? As I think we all have experienced, we don't often practice healthcare, we practice sick care. So what is sick care? Sick care is kind of what we're used to. We tend to go in once a year, maybe for a checkup, or God forbid you have a problem from COVID to a fever. You get that very intermittent data collected in the four walls of the clinic or the emergency room or the intensive care unit. That very intermittent episodic data leads to a very reactive mindset. We tend to wait for the patient to show up with a heart attack or a stroke, or in my world of oncology, with a late stage disease. And I think the potential of what's already here is to take a lot of these emerging technologies and be much more continuous with our information, make that much more personalized, make it much more proactive and preventative, and start to bring care arguably anytime, anywhere, hopefully with much better costs and better outcomes, whether you're on a mountaintop or in a big city like San Francisco or Wellington. And so big picture, we have the opportunity not to just hopefully predict and prevent disease, but even this idea of optimizing our health and wellness, to think about optimizing not just living forever. A lot of people in San Francisco want to live forever. That's a long time. We want to optimize health span, right? We want to make 120 the new 60. And so, you're able to go base jumping when you're 100 or other things, and feel active and able to do that. So I think that's the goal, I think, of a lot of these things we'll talk about. Technology is great for the sick care side, but also to start to optimize the sort of health span side. And there's a whole new field of longevity-based medicine, which we won't really cover here today, but to try and even stop and reverse aging. But where are we in the big picture? I know US is not doing very well compared to other countries, including New Zealand, and we're actually going down in life expectancy. So we're lots of room for improvement. We're dipping below China, even in the US. And I think many countries, including New Zealand, do a much better job than the United States in terms of being proactive and having integrated care. It has its challenges, but definitely the US, while spending the most per capita, is way down the list on outcomes. All right, so what are the opportunities here? The opportunities are to think differently about everything from our own health and prevention. We'll talk about things we could be doing today. Diagnosing diseases at stage 0, not stage 3. Therapy, which can be not just a drug or a device, but soon can be a video game or an app. And how do we kind of speed up this democratization and learning around the planet? So if you want a good summary of all this, there's a great issue of National Geographic that I was lucky to write the opening article in 2019. And the theme wasn't really about 12 innovations, but more about the idea that it's these innovations coming together that gives us this opportunity to do things differently. And many of these innovations or technologies are moving really, really quickly. So one takeaway for you all is to become exponential thinkers. And some of you are much better at math than I am, I'm sure. But it's easy to think linearly. 30 linear steps, I'll be to the exit. 1, 2, 3, 4, 5, that's 30 meters at 1 meter per step. But if I'm taking exponential steps, 2, 4, 8, 16, 32, 64, by the 15th step, you can kind of do the math, you're at 32,000. But 15 steps later, at 30th steps, you're at 1 billion meters. That's 26 times around the planet with that 30th step. That's the power of exponentials, which is sometimes a bit surprising. And we've all experienced exponentials in our technology. You all know Moore's law. That's the power of computing that makes our supercomputers fit into our pocket now, right? This is my old antique iPhone 2, which still works when I charge it up. It felt amazing 10 years ago. Now it feels antique thanks to Moore's law. What used to fit in a processor in 85 is now billions of times more. So you need to pay attention to the exponentials and where those take us. And soon Moore's law will be supplanted by quantum computing, which is a whole other topic, but we're really getting into this really fantastical age. And that again gives us these new tools and technologies to address the whole healthcare continuum. And back to the smartphone for a second. It was only 30 years ago that Michael Douglas was on the beach talking on a phone. I thought that was incredible. If some of you are that old to remember the first, mobile phones. I remember actually in Auckland, we have a family friend who's quite well off. I was there as a medical student in the early 90s, and he had a cell phone in his car. It was in a big box. I was like, oh, amazing. We could call my mom on a cell phone from Wellington to DC. I thought that was incredible. Now, of course, that's passé. And of course, even the smartphone will be dissolving soon into our augmented reality contact lenses, or the iPhone 16, which is rumored to be built into our glasses, or into our contact lenses, which will soon start to transmit health and other information, or soon might even be laboratories on our eyeballs. So kind of think exponentially where things can go with a few more clicks of Moore's law. And just back to the basics of what we can do with our cell phone today, it's really becoming a medical device. It's becoming a medicalized smartphone. You can use the sensors in it for some interesting applications. For example, you can modify the speaker and the microphone to listen to your kid's ear and pick up an ear infection without having to take them to the pediatrician. The pediatrician might not like this technology, but it's quite useful, right? You can use the camera to pick up changes in someone's face and track pain, for example, or take a picture of a wound remotely and help manage that with AI and machine learning just from a smartphone-based diagnosis. So on this exponential, what used to fit on your desktop now fits on your smartwatch, right? Many of you are wearing smartwatches. Those now have FDA-cleared applications to measure atrial fibrillation or a fall. And so we need to be thinking along this pathway if we're going to reimagine health for ourselves and our communities about what's possible today and what's going to be possible in the next decade, right, across that whole care continuum. So think along this new digital pathway, because it's really quite disruptive, right? You don't buy a GPS unit anymore or a flip video camera. It's all become an app, right? So those apps are essentially free. They're demonetized. They're dematerialized. They're digital, and they can be democratized. You can send these software packages around the world at the press of a button. So things are accelerating, and that means we need to think differently. And I think while the last 10 years were pretty interesting, the next 10 years will be even more so. Most people tend to overestimate what they can do in 1 year and underestimate what they can do in a decade. Bill Gates quote. So don't underestimate the power of the next decade in whatever field you might be in. Change is coming faster than we think. So that gives us a bit of a lens to reimagine almost any industry. But we'll focus here on healthcare. We've already seen big shifts. Each of us now as a consumer can leverage our smartphone devices and can compare one hospital to another. Or there's Yelps for doctors like Vitals.com. You can rate a physician or nurse. You can go to GoodRx, compare pharmacy prices and pick the right price, best price for you. Or if you're about to have, let's say, a knee surgery, you can go to the surgical scorecard and look at the best surgeon and look at their outcomes based on a knee procedure, for example. So a lot more transparency and power is in your hands. And a lot of that, of course, is riding the Internet of Things, but now the Internet of medical things, right? All these interconnected devices, some of them are medically applicable. And they create lots and lots of data. There's all this exponential data, and data is the new oil, right? But we don't really want data, particularly by itself. We want the insights. So we want to accelerate this move from data to actionable information that you can use as a human, as a patient, as a consumer, as a caregiver. And not just understanding that information. It might get published in a great journal, but rapidly moving or narrowing that gap between when it's useful at the bedside or the website. Because sometimes, often it still take 10 or 20 years to translate from knowledge to utility. So that's a big picture element. And of course, how we communicate that information is important. We've all seen the impacts of the infodemic, right? You go to some, we're here in the blue bubble of California, but you go to one, let's say, red zip code in middle America compared to a blue zip code. The folks who, let's say, had mortality and morbidity from COVID is dramatic based on folks who didn't get vaccinated for all the wrong reasons. So it's not just about the information, but how you communicate it. And while technology, of course, is great, it's not the deciding factor for innovation. It's all about incentives, right? The incentives might be quite different in the NHS or New Zealand or at Kaiser or at Stanford. So we need to think about who pays for medicine and what's rewarded. Because in many Western countries, we still pay for sick care. And we're starting to move, we have some folks here in occupational medicine, start to move to prevention, right? Paying for prevention, which is where the money should be, rather than paying for the advanced disease when it's expensive or impossible to cure. And so we're seeing new incentives come along. It's often called value-based care, where outcomes are going to be the new incomes, paying for preventing the disease or treating it in smarter, better ways. And some of those incentives are changing where care happens, from hospital to home to phone to on to even inside our bodies. At least in the US, a lot of care can go to your corner pharmacy, your Walgreens, your Minute Clinic, or to your app. We'll talk more about virtual visits later. Walmart is building big box, healthcare centers in their big stores, which include veterinary care, mental health care, eye care. Of course, they have the pharmacy built in as well. Some of them are building little health pods where you can go get telemedicine done, as well as have your vitals and labs checked in remote areas. So where care happening is shifting. And a lot of that is sort of this new mobile age, or mobile health, connected health, digital health. I think we'll just soon call it health, but it gives us the ability to connect the dots between all these new forms of data and make it super useful for you as a clinician, as a patient, as a caregiver, in public health and beyond. And there's now 300,000 or more health apps on the smartphone stores. The challenge is, what do we do with them, and how do we make sure they're useful? There's a whole set of groups now studying digital health because it's not a one-size-fits-all phenomenon. There's now FDA-approved apps that you can prescribe to treat certain conditions. But we still have a long way to go. It's still the early innings of this era of digital health. And now that there are 300,000 apps on the market, you don't want an app or a different wearable for every condition or every medication you're on. We're going to see a lot of consolidation, kind of like the one ring to rule them all, Bilbo Baggins for healthcare. So watch for that consolidation. And it's not just about digital. I mean, think about all the things that are accelerating: AI, robotics, 3D printing, nanotech, blockchain, virtual reality, synthetic biology, all super converging and giving us the ability to create entire new fields. It's hard to read the slide maybe, but there's lots of things that didn't exist when I was a medical student, from computational biology to robotic surgery to digiceuticals. I mean, we didn't have that, right? Now we have these new tools that we can use to address challenges in healthcare around the planet, from the rising costs, aging populations in many countries, access to care, whether it's rural California, the tip of the bottom of New Zealand, rural Africa. We don't have a lot of doctors and nurses and specialists in many parts of the world. We also have the challenge of making sense of all the new fragmented information and the challenges of who regulates this, the FDA, the F word, or the insurance companies, which have the hammer on who pays for what. So I've had an interesting lens on some of this. Through the pandemic, I've been the chair of this XPRIZE Pandemic Alliance. We put together a whole 100+ organizations to address challenges of the pandemic, from PPE and diagnostics and testing and better ways to get vaccines out there. We ran an XPRIZE. Oh, we've done other XPRIZes. Like I came up with a medical tricorder XPRIZE about eight years ago to foster better diagnostics. But during the pandemic, you might remember the first year or so, testing was quite terrible. It took days to get results. So we ran a $8 million XPRIZE for fast, frequent, cheap, and easy COVID testing. We had crowdsourced competition of 700 teams from 70 countries and some pretty incredible winners that came up with some pretty unique ways to make testing faster, better, cheaper. And many of those are going to market now, including a clever one, that just a little cheap card that tests your smell. Remember, smell is often one of the things that would go away, at least the first strains of COVID. Now that comes with a smell card and an app and is being distributed in parts of the world to help screen for folks early. So lots of innovation coming to diagnostics. But just to pause here, because we're going to kind of focus on technology. Technology isn't our biggest determinant for outcomes. It's much more our social elements. Your zip code is much more important than your genetic code in terms of your likelihood to live a long, healthy life. And we've seen some of those disparities, very clearly during the pandemic. And I think, there's inequities all around the world, including in New Zealand. And so we need to do a better job of bringing, healthcare for all, no matter age, culture, education, and location. And also paying attention to sort of the basics. You might have heard of the blue zones, certain communities where folks live longer, healthier lives. And there's some lessons there from, social connection and respecting your elders and more movement and, better basic food and maybe some red wine. So you need to pay attention to this kind of core Maslow hierarchy, in public health and beyond. Access to vaccines, clean water, not having food deserts, social connection. Lots of challenges and opportunities there. And also the digital determinants of health. Does someone have access to Wi-Fi? In many parts of the world, they don't. Or good battery life. If someone can solve for that, that'd be great. That's the core need for many of us, charging your phone. So let's pay attention to the digital determinants as we go. And now we're seeing some of that access open up around the world. You've heard of Starlink out of SpaceX, now piping data to the Ukraine, and soon will open up to many parts of the world that don't have internet access. So whole big elements are opening up to this digital world of healthcare and beyond. So this all gives us this lens for new forms of innovation, right? You've all, here in San Francisco, Uber started, I think, only 12 years ago. They're an exponential kind of company. They definitely have made some missteps and challenges, but think about it. They didn't invent the smartphone, GPS, online maps, online payments. They kind of connected the dots so that we could press a button and get a car to come to you, right? That's been somewhat disruptive to the taxi drivers. Uber and Lyft now actually deliver patients to the clinics or nurses to give vaccines. There's even this one, human Uber, developed in Japan, provides a way to attend events remotely using another person's body. It's surprisingly natural. So your next Kiwi Can Fly event, send your human Uber as a proxy. Or there's like Ubers to bring doctors or nurses to you for house calls or to deliver your drugs. Or just yesterday, I had a lab test at home through this Scarlet thing. I could track the person. They came to me and did a lab draw, just doing some fun labs to check up on things. And it was all done at home, kind of easy, press a button. So we all kind of want to get that easiness, that user interface for healthcare in new forms. The challenge and opportunity is all the big players are getting into Apple, Samsung, Microsoft, even Facebook getting into healthcare. Amazon especially is getting into healthcare in powerful ways. And we know Amazon is pretty smart at consumer behavior elements. They're now getting into the pharmacy space. I used to joke about Amazon delivering drugs by drone. And just last year, a company got FAA approval to deliver drugs, devices, medicines in the US by drone. So I'm sure that'll be applicable in many rural parts of New Zealand. It's already been used in rural Africa to deliver blood products and beyond. And published in New England Journal a few months ago, the first drone to deliver a defibrillator to someone who needed one in the setting of a heart attack. So some pretty unique applications of technologies that are moving pretty quickly. So this means change is coming, right? No matter what field you're in. Pharmageddon, the big pharma companies, the blockbuster drugs won't be the same when we can be more personalized. It's coming to our insurance companies. I mean, who likes to interact with their insurance company for health? Not very fun. It's getting more engaging with better design thinking and user interfaces. And big picture, many of us remember Kodak and Blockbuster and Brim, BlackBerry, all these big companies which were top of their game 10, 15 years ago have gone bust, right? And Kodak is the usual one to pick on. They invented digital photography, but didn't want to cut into their film sales. They're very quarter to quarter thinking. And as digital photography got exponentially better, they fell off the cliff, and 12 kids down the street in Palo Alto built and sold Instagram for $1 billion. So you don't want to be the next Kodak. You want to be the disruptor, not the disruptee. You want to be Ubering yourself before you get Kodak. So that's one way to think about the future in a nutshell. So I've had an interesting journey in the last 10, 12 years looking at this sort of interface about the future. Oh, just a reminder, sometimes things seem like they're going to be here faster. We tend to overestimate what's going to be here in the short term and underestimate the long term. That's called Amara's law. So just because something doesn't seem perfect yet, don't dismiss it. I was in the Dubai airport a few months ago and I saw this. I took this video. It looked like a drunk suitcase following this guy. I'm like, what is the suitcase doing following this guy? It looked a little, wasn't quite perfect yet. They kept kind of bumping into things, oops. So not perfect yet, but give it a few years and probably the drone will be following you, it's taking your suitcase behind you, right? So I've had an interesting role looking at this. I've been the chair of medicine for something called Singularity University. I've run a whole program called Exponential Medicine for 10 years where we bring about 800 people together to the Hotel Del Coronado in San Diego. We've got a lot of Kiwis there as well. We're now rebranding that to be called NextMed Health. But the idea is the future of anything is not being siloed, but bringing patients, physicians, technologists, investors all together to see what's the cutting edge and also to bring what's next, and also to bring your mindset up to what's possible. I love this quote shared by the head of innovation from NHS. The difficulty lies not in the new ideas, but in escaping from the old ones. Because a lot of people are stuck in their old ways, and that's often more the challenge than the new shiny objects. So we brought the FDA there. They thought how to regulate things faster. We're going to be back at the Hotel Del in March, our first post-pandemic event. It's called NextMed Health. So hopefully you can bring yourselves and your friends and family to San Diego, and NextMed Health is the website. Okay, let's go into 3 areas quickly and think about what you can do for your health and those of your friends and family going forward. Let's start with prevention, right? That's worth a pound of cure, right? We know that most of our diseases isn't really driven by our genetics, but by our behaviors, particularly our bad behaviors. And we're just starting to be able to measure those in real time, right? 17 years ago, I did a project with NASA. We built a black box for the astronauts. It was this huge device that measured our steps and basic vital signs. Now that fits on a Fitbit. The first Fitbit only launched in 2009, like 13 years ago. Who's wearing a wearable right now? Just curious. Who's got a wearable on? About half of you, right? I've got about 5 of them on. I got 1, 2, 3, 4. I won't show you all of them. What's interesting about these is they can measure almost every element of your physiology and behavior. And actually, the first time I ever jumped out of an airplane, I did it twice. I was all wired up, and it was a study on anxiety. And so, now you can put that in your ring and track I don't know if you've done that when you jumped off a cliff. You should probably look at your vitals. That'd be kind of fun. And these sensors are going from your wrist to digital tattoos that can be powered by your motion. So this sort of era of wearables is going beyond your Apple Watch to even small data. Everyone's not always wearing a wearable. Most people carry their phone around, and the phone can tell a lot about your risk for disease or how healthy you are. And even small data can be useful. This is some data from UCSF down the street. They sent patients home after a total knee replacement. Are they walking more, as you might expect, each day, or are they walking less? If they're walking less, maybe you need to intervene before they have a problem or complication. And so we're kind of moving from this era of data geeks, like many of us, quantified selfers, to quantified health, where that data is going to start to flow to your clinician, to your health system, to optimize your health and wellness, to pick up diseases early based on your digital biomarkers, and to treat disease in smarter, more feedback-generated ways. So I'll give you a few examples of what's been digitized. Of course, the scale's been digital for a while, but now a San Francisco startup called ShapeScale doesn't just do your weight, but whether you like it or not, they also measure your shape, like any changes in your skin, how much fat do you have, how much muscle do you have. That might be part of our daily or weekly physical exam at home. The blood pressure cuff, which is an old measure, but super important, is now shrinking and dissolving into radar-based versions that will fit into your future watch or patch. And that's going to be super interesting. Even next generation watches might do real-time blood sugar. There's patches you can wear now. They're just coming to market. They can stream like 16 different vital signs, basically an intensive care unit on a patch. And that can be useful for chronic disease or other indications. And there's even wearables coming to your shoes to track gait if someone's likely to have a fall, or into side contact lenses that are so small that they can integrate laboratories, or chips underneath the skin that can measure vital signs and laboratory elements. So bottom line, think about all these new sensors as they get smaller, faster, cheaper. They're going to give us new ways to measure things, not just in your standard Fitbit. And then there's the idea of something that can give you feedback. I like to call these trainables, right? In our smartphone era, our postures aren't often very good. We're hunched over our laptops and our phones. But now you can put a little sensor on your back. This comes from a couple of Israeli fighter pilots. It's called the Upright. You can buy it online. You put this little sensor on your back, and it's like your digital mother. And it knows when you're hunched over for too long, and it measures that. And when you do that for too long, it gives you a little buzz. Stand up straight, Daniel. In about a week of wearing this, your posture is much improved. You can give it to somebody else. So that's an idea of a feedback loop, right? Some of us need more than a little buzz. You might want a shockable. That'll help you stop biting your fingernails. Hearables that can also play music but track vital signs and give you other feedback. Ringables. I don't know if you've all seen this. Some of you are wearing an Oura ring. I'm sure you've seen these little smart rings. I can't get mine off. It's like a Fitbit on your finger, but these can do a lot more now than the old-fashioned Fitbits. They can do temperature and heart rate variability. They can do a really good job of tracking your sleep. So if you guys do nothing else from this talk, go out and find something that helps you track your sleep and improve it, because it's super important in prevention and managing disease. There's lots of ways to do that at work or other places, managing your sleep. But pay attention to sleep. It's easy to measure and now helpful to improve. These Oura type rings can even track pregnancy and pick up who's pregnant 5 days before home pregnancy test. Or UCSF did a study with these consumer rings, and they could tell what your antibody titer was after your COVID booster. So consumer devices are becoming medicalized. You can also do interesting things with, I call them breathables. You're going to go out on a social engagement now that we're back in real life, sort of. You can track the quality of your breath, bad breath or not. It can be measured. But also the nano noses can pick up, might you have cancer or metabolic disease from your breath. So quantified breath. There's the ability now to track your sweat. Gatorade is selling a patch now, but it can be useful for heart disease patients and others. Sockables can track the health of a diabetic patient's foot, so they won't have a hot spot and maybe need an amputation. I won't show you mine, but there's even underwearables, little sensors that are so cheap. You can put them in your underwear and they'll last for a year, and each underwear, you have 10 pairs of underwear. You can just put them on, it'll automatically sense your vitals. And these are being paid for now with some of the new incentives in terms of the billing codes, so we can do what's called remote patient monitoring. There's even now smart walking sticks. There's ways to help folks who are very disabled. Someone who's paralyzed now can put on a wearable exoskeleton. I had a chance to try one out a few months ago. This is a newer version out of Europe. It's 3D printed. It has AI enhanced software. So I could very quickly put it on. It's quite weird to press a button and have it walk for you. But if you're paralyzed, this is quite a game changer. And it's an example of enabling the disabled. But soon these sorts of technologies will start to enable all of us, right? These are now exo boots out of MIT, which will enable us to climb a mountain when we're 95 years old and might have a little muscle weakness. So watch that space. It's getting interesting. And since I'm a pilot, I love the ultimate wearable, the jet suit, right? So you might need to go rescue somebody in a mountain. You can have an EMT or paramedic come rescue wearing a jet suit. That's in early trials. I had a chance to fly this a couple of years ago. I was tethered, thankfully. These are my better flights. Most of the time, I did not look like James Bond. I look more like a bad version of Mission Impossible. But practice makes perfect. It's kind of like riding a bike, I'm told. Anyway, so what else can we measure that's super important? Food. Food is medicine. That's an old phrase from Hippocrates. You can measure your meals now with lots of different apps, including what's in your meal and its calories and content. So you can measure your input, and you can start to measure your output. Lots of companies are starting to build home-based sensors for, you can guess what. So new data will be coming from our toilets. And what's interesting about this is we can put this data together, right? Your inputs, outputs, your metabolome, you can now measure with a low-cost sensor your blood sugar, even if you're not diabetic. And we'll start to put that data together to personalize our diets, because a lot of these fad diets are not one size fits all. We're going to use these tools to build precision medicine. I know I'm between us and lunch, so I'm going to try and finish up fast. All right. Also, this idea of invisibles. Your camera on your smartphone can pick up your vital signs without wearing anything. So there's a whole new generation of cameras and other sensors that are going to start to track us, whether we like to or not. Cameras can pick up behavior, helping folks age in place safely without having to have lots of sensors. Voice is another invisible. Your voice can change when you have a neurologic disorder, a mental health issue, or the sound of your cough changes when you have a common cold or croup or COVID. And there's an Australian company called ResMed, came out of Queensland University, just got sold for $120 million to Pfizer, that builds this app that listens to your voice and your cough. So that's another way to measure health and behavior. Or how you work on your smartphone. It can tell whether you're drunk or whether you have something else going on. So there are lots of new signals coming together, including even Wi-Fi. Wi-Fi is all around us. That can start to measure vital signs of multiple people in the same room and start to be quite predictive. Everything from Parkinson's disease to heart disease will be picked up. So the challenge and the opportunity is we're going to start to be censored. Our digitome is going to be collected 24/7. What do we do with that information? Who owns that information? How do we control it? How do you opt in to share it or not share it? And what incentives get changed? There's some life insurance companies that will give you a lower life insurance premium if you're walking 10,000 steps a day. And some of you are entrepreneurs. I know what you're thinking. There's new business models out there, but it's quite hard to cheat because actually your wearable can tell from your gait who's wearing it. But there might be people who try and cheat on this going forward. So all this data is exciting, but it's not useful unless we can do something about it, right? What is it, doctor? Just as I thought, you're generating too much data. We don't want more data. We want the insights. And that needs to fit into the process of medicine, because doctors don't want to get your Fitbit data right now, right? It's already overwhelming enough to use our often very kludgy, burnout-inducing electronic medical record systems. So we need to do a better job of integrating these new forms of information into our workflow. This idea of improving the clinician experience is getting increasingly important. And we're now able to hopefully share that data with our clinicians in new ways. You can do it on your Apple Health Kit. You can now start to share that with iOS, even on Android. And the opportunity is to make that data useful. So Verily, which is one of the Google companies, is doing a project called Baseline. 10,000 or more volunteers are sharing their medical records, their digital data from their wearable devices and home elements, and they're making sense of that. They're crowdsourcing it to enable us to use that information because we haven't had that in the wild, your connected smart home and wearable to make sense of that. So where that takes us, in a summary, is this idea of predictalytics, almost like a FICO score for your health, integrating your vitals, your labs, your financial health, your social connection strength. And when that can come together in early ways, it'll give us a bit of a personal check engine light, a little early warning before you blow the gasket. Like you pay attention to your check engine light in your car, hopefully, you should hopefully pay attention to your personal check engine light. And this isn't science fiction. One of my colleagues at Stanford, Mike Snyder, has been building these check engine lights initially for himself. He picked up his own Lyme disease and diabetes much earlier than he would have been diagnosed earlier. And his lab has also showed that wearables, simple wearables, can determine, when you have the flu or even 2 days before you show up with COVID symptoms that you have COVID. So we'll start to use these again as proactive check engine lights for infectious diseases and others. And this is just data from my own Apple Watch. We'll start to integrate that data over months and years, and you might end up, not waiting to have that problem, but getting a little ping from your AI doctor suggesting you go get checked up based on your digital, biomarkers. The fact that your resting heart rate went from 52 to 62 to 72, something might be going on when you're sleeping, and you might go on and get checked out. Now, this has some dystopian, but some public health measures. We're all familiar now with contact tracing, and you can sometimes tell from your social network who might be sick or not sick. And so I think part of this future is going to be crowdsourcing our health data around us. And when we walk into a room in the near future, you're going to know who to shake hands with or not shake hands with, as it might be. I think Xavier's okay. I hope. I know Divya's fine. I checked her social cred. So this will be part of our future moving forward, hopefully in privacy-inducing ways. So you guys will remember Minority Report, right? The guy shows up before the crime is conducted. Hopefully we'll have a bit of a Minority Report for early diagnostics. Now, I've shown you lots of ways of collecting data and insights, but you might have all the insights in the world. You're supposed to exercise more and eat less, but we don't often do that. So we need some help with behavior change, right? Sometimes it's a human coach. Sometimes it can be an AI coach or a robot at home to help older folks take their medications. All of this can engage us much more in our health. We can be the co-pilot in our care, understanding our data. But we can't present that one size fits all. We need design thinking. San Francisco is a big home for like IDEO and other design thinkers. And, we need to design things to match whether you're a baby boomer or a millennial. You interact with health data in different ways. So if you guys are building any solution, think about the user. It might be the same underlying technology, but how you present that might change. In San Francisco, some of you might have checked out the Forward Clinic. It's kind of like an Apple-esque type store, Apple-like primary care clinic type of experience. Not for everybody, but for the millennials, they might like it. And this is technology out of New Zealand, Soul Machines. They've been building, it's hard to see it, sort of virtual avatars that they might not be real, but they feel real, and we respond. Maybe we can turn off the front light too, so that the video show up a little better. People feel like they respond to them in the same ways. That's some amazing technology out of New Zealand, sorry. And so voice can be part of our coaching. You've all used Amazon Alexa, but they can be used in operating rooms, in hospital rooms. They can be, Alexa, help, I've fallen, I can't get up. Or Google Home, what's my refill going to be arriving? All those could be used, whether you're 9 or 99, you can use voice. You don't need to program a computer. So imagine this not so distant future when we all have a kind of our personalized health coach. It doesn't just show you of today when you look in the mirror, but it might show you of tomorrow. You of tomorrow if you're doing your Peloton and working out. There you are, Peloton, exercise. What happens if you keep having Dunkin' Donuts or those amazing New Zealand pastries I had earlier? That's what happens, right? And I don't need to wait for that dystopian future. I can see myself now and 100 New Zealand pastries later. Okay. My grandmother in New Zealand used to make amazing bacon strudel. I loved a strudel, but I will only have one slice. Or if you have a friend who smokes, you can show them what they're going to look like before smoking and after smoking, future you. That can be a powerful lever for change. Or what happens if you spend too much time on social media? Okay, so. And this brings us to this new world, I'm going to skip this video, of augmented, virtual, and extended reality. Remember Google Glass? These are my antique Google Glass. Oops. They were not a great consumer hit, but augmented reality has a lot of great applications in healthcare, including for clinicians to see pretty complex information in real time. Or it enables a surgeon to be guided step by step, seeing through your body in safer ways. It also enables you to sort of see inside your own body and understand your own condition. It might be a hypertension, it might be a coronary artery disease. So there's some great technologies to educate all of us about our health. This is an augmented reality t-shirt that can be great for educating kids. In fact, my son Leo is here. Stand up, Leo. Here he is when he's 3. Now he's a little bit bigger. And he's wearing his augmented reality shirt. And now he knows a lot more about his heart and lungs than he used to. So, right? Okay. Thanks for coming today, Leo. He came for the pastries. He's staying for the New Zealanders. Okay. And these technologies sometimes start a little bit kludgy. These magic leap glasses will soon dissolve into normal-looking glasses, and they can be used in interesting ways. As mentioned, I've been a pilot. I've been a flight surgeon. I love to fly. We use now what's called heads-up display in the fighter cockpit. You don't look at the dials. You look outside the cockpit. You look through it, and you get guidance about where the bad guy is or where your wingman is. Or if you're about to hit a mountain, it can talk to you and give you a little warning. Whoa, that'll wake you up. The pull-up thing, it's called bitching Betty. It's a terrible term, but it'll remind you what needs to happen. So imagine our future where we have this embedded in our glasses. We see our breakfast in one way and then in another way, and then it gives you a little nudge before you have your breakfast. Pull up. Sorry for the wake-up call. Okay. What about virtual reality? Who's tried virtual reality? Most of you? Have you put grandma on a roller coaster? Okay. It's not very nice, but it's effective. So VR is pretty amazing now. It's not just for gaming. It can be a therapy. You can put patients in with bad pain into a cold environment. Oh, I can't hit the button today. Into a cold environment, and they throw snowballs at penguins, and they need almost no opiates because they feel like they're in a cold world. You can use it for mental health. You can use it for physical therapy to get more folks engaged in physical therapy. No one does their physical therapy, but now you can gamify it and make it fun. It can be used in scary environments. So if you're stuck in a hospital, you can be in your VR headset and be at the beach instead of in the hospital room. Or for those of us who like smell, you can add virtual reality with smell. Or I'm not sure if it's yet being used for happier sheep, but for happier cows. This is an experiment that got published. Happier cows in a VR environment. Go figure. So it also can be used for exercise, virtual reality workouts. I spent 100 days in this app called Supernatural during the pandemic lockdown. I got my resting heart rate down by like 8 or 9 points just working out every day. New immersive ways to engage with VR. One of its biggest applications, of course, is in education, including medical education, right? You can now learn about different heart conditions and walk inside a heart. I can never remember all these conditions on paper. Now you can experience it in new ways. You can be in an operating room and you can see what's happening with virtual live stream surgery, democratizing surgical education. And simulation is becoming a new way to train medical students, nurses. I mean, we can simulate almost anything today, and I mean, anything can be simulated, but some things you don't want to practice on you, right? So the future of medical education is often this idea of now going, at least for your surgeon, to practice on virtual you, not you. So this is a San Francisco company called Oso VR. You put on the headset, and the surgeon can practice just like a pilot in a flight simulator. And imagine we could glean all the lessons from thousands of surgeries, this idea of like a Waze for surgeons. And just like we have, driver assist, and we're going to move to surgical assist. Some of you drive Teslas. It's kind of getting close to autonomous driving. We're going to start to see that come to the operating room, especially as robotics get better and better. In fact, this is a fun one for some of you who don't like needle sticks, autonomous robotics that can draw your blood. So we're getting interesting in that regard. So to sum up this part, and I think I'm going to go about 10 more minutes, is, we're now in this era of connected devices and new forms of data. That's going to become much more integrated as insights that are personalized, that can be predictalytics for you and your community. And the next decade will come layered in a much more integrated, crowdsourced, personalized, effective way. Okay, let's switch to 2 other things quickly. Diagnostics, right? We don't want to wait for disease to come. We want to diagnose things early, like dementia. We can now predict who's going to get, let's say, Alzheimer's 10 to 20 to even 30 years before someone might have it, not using lab tests and scans, but even video games that track eye tracking. And we might enter up in a world where we treat Alzheimer's disease with a drug at stage 0, just like we treat heart conditions or high cholesterol with statins. So we want to move to an era of sort of earlier, smarter diagnostics to hold things off and keep them from biting you. And that comes to this new era of imaging, right? We're all familiar with imaging. This is my brain with color-coded MRI data. In fact, there's several companies you can go to now in the Bay Area for about $2,000, get a full-body MRI done in an hour. Still expensive, not for everybody. But I think in the next 10 years, you'll be able to go to your corner pharmacy and get a full-body scan, and the AI radiologist will read it. And these scanners are getting cheaper. Here's one that came to market last year. It's a portable MRI machine, 20 times less expensive. In fact, I had my own brain MRI'd while going down the Hudson River on a boat, plugged into wall power in 5 minutes. And that, not the perfect MRI, but it's great for most indications. Or another friend in the Bay Area is building a wearable device called Open Water that is like a headband that will do what an MRI machine does. So diagnostics is getting smaller and cheaper and can start to fit into our pockets. So it could be, a rural part of New Zealand, a rural part of California. We can have all the diagnostics in our pocket. 10 years ago, we had the first diagnostics, the ability to do a glucometer in a smartphone. We had the first examples of an EKG that could fit into your smartphone case. Now you can get an FDA-cleared EKG device that'll do 6 leads, and you can see advertisements for it in CNN. So the world is shifting to digital diagnostics that you can do yourself and connect that to your clinician. These are some of my own digital diagnostics tools in my pocket in my home medical bag. Or if you're doing a virtual visit, you can now not just talk to the doctor or nurse, but have your home diagnostics kit. So the basic example of what these can do is they can upskill. I was never good at listening to heart sounds. Now you can have a virtual stethoscope that also does an EKG and do a much better job at diagnosing a heart murmur. Or we're going to get rid of our stethoscopes altogether because now there's AI-powered ultrasound devices that used to be $200,000, now they're $2,000, that can bring ultrasound technology and diagnostics anywhere on the planet. So we're democratizing diagnostics and hopefully improving outcomes in sometimes very remote regions, including this company in Kenya. They're kind of trying to build the one medical for Africa, integrating these pretty low-cost diagnostic devices and bringing them to areas that almost had nothing until recently. And that includes laboratories. You don't need a central lab. A lot of laboratories can be done on a chip. A lot of laboratories can be done with a smartphone, just the camera itself. So a good example is this idea of a medical selfie. So this is a company called Healthy.io out of Israel. I'm on their board. So instead of taking your urine to the lab to check for a UTI or preeclampsia or early protein, you can just dip the urine at home, take any camera now, take a picture of their dipstick, and the results go immediately to you and your doctor or to your pharmacy. So easy peasy, right? So that took a lot of work to get through the FDA, it just got approved, but this could be a great tool for screening for disease, particularly in diabetics and folks with high blood pressure, to pick up kidney disease before they have a big problem. Also, cancer. I'm an oncologist. It's something we want to pick up early. Pick it up early makes a big difference. Biden was involved in the moonshot even before he was president, and that's driven a lot of innovation in the space, including now the ability to do early cancer screening with a blood test. This is a company out of California called Grail. You can now, as of this year, do this yourself. Get a blood test that'll screen for 10 or more cancers that are very important to pick up early: pancreatic cancer, ovarian, lung cancer, and hopefully find it before it's too late. Thematically, this is riding the exponentials of cheap genomics. Has anyone here been sequenced? Full genome, anybody? Okay, one of you. What's interesting about genomics is the price of sequencing has dropped at twice the rate of Moore's law. It's down to about $200. And arguably, it will be $100 and maybe $10 in 10 years. What can we do with our basic genetic information? You can help that to pick the right drug and right dose instead of one-size-fits-all drugs. We can use genetics to understand disease, like type 2 diabetes is not one disease, it's at least 3 or more very distinct subtypes that respond differently to therapy. So our future is one where we're going to use this information even before you're born to help predict and hopefully personalize your healthcare journey. And of course, we need to make more equitable databases, not just ones from Caucasian Europeans. We need Asians and Maoris and all sorts of folks in these databases to make them more useful for all. And of course, there's the genome, there's the proteome, there's the exposome, there's the microbiome. All the bugs on our skin and inside our gut play a huge role in your risk for different diseases, from brain disease to heart disease to GI disease. And we're going to see a lot of innovation in the GI space. You can get your own microbiome tested today, and soon we'll start to leverage that for therapy to treat everything from obesity to Crohn's disease. So now we need to connect the dots. So I've shown you lots of technology, but it's overwhelming, right? There's no way to make sense of it as a human, as a patient, as a clinician. We need some help. And that help is arriving. I mean, there's a lot of buzz about AI. I like to call it more IA, intelligence augmentation, because AI or IA is becoming really a game changer. It's just really starting to impact clinical care, from being able to do drug discovery to being able to predict what you're going to get early, to being tools that you can use. You can be your own dermatologist with several apps that you can download on the web. It's being used to help radiologists do a better job of screening. Pathology is becoming digital, so you can take an image of that breast biopsy and say, is that breast cancer? Is it not breast cancer? What markers does it have, without ever having to do any molecular analysis? It can be used to look at the back of your eyeball. Bottom line, when we layer all this information together, we're going to get off of what's called this idea of a personalized digital twin. It could be a digital twin of your heart to measure and help predict heart disease, or it might layer all these multi-omics together to give you a much better gauge about what's optimal for your prevention, diagnostics, or therapy. And so we're going to see this advent of personalized vaccines, for cancer, but also personalized vaccines that will treat and prevent everything from heart disease to Alzheimer's. So lots coming to that integrated future. And that doesn't mean we're going to replace the doctor or the nurse. It's going to be about a collaboration. AI is not going to replace your doctor, but the doctor, nurse, pharmacist, hospital system using AI will replace those who don't. All right, let me close with therapy. There's a lot happening in therapy, from gene therapy and otherwise. I'll skip all the genetic therapy and just mention this era now of digital therapy, right? Many of you experienced your first virtual visit during the pandemic. It was a huge spike. It's come back a bit down to earth, but the future of virtual care isn't to press a button and talk to a nurse or doctor. You're going to start talking to an app and a chatbot that is going to more and more know you and do smarter triage. It'll know whether you had your appendix out or what your genetics are or what your medical record said before it triages you. We've had a big challenge with mental health issues through the pandemic. You might think the volume might just come down. This is a virtual psychologist.
But I try to stay happy. I'd rather
look at eye
happy.
gaze, smile level, voice
my
tonality.
My kids keep me going.
What advice would you have given yourself 10 or 20 years ago?
So that's part of our integrated future. Or your doctor will be showing up as an avatar, not just in the metaverse, but the metaverse that's quickly arriving. So how we interact with our clinical teams will become more and more meta. It's going to be applicable. And that begs the question, who do we choose to be the next generation of doctors, nurses, pharmacists? Do they need to be trained not just in bedside manner, but also in webside manner? Because it takes different skills to interact virtually. And we're starting to enter the era when I don't just prescribe you a drug or device, but an app. There's now apps to help with smoking cessation, with mental health, video games to treat kids with ADHD without a drug, but with a video game. And lots of kids like video games, right, Leo? Yes. So there's even, at scale video games that will be integrating for mental health. So many, many examples of new ways of prescribing and interacting in therapy. This is on the digital level. There's so many of these applications out there, it's hard to keep track of them. So I just launched 2 months ago a new platform called Digital.Health. So if you're curious about what's out there, go to Digital.Health, easy to remember. And it's a bit of a digital health database and formulary. You might be interested in looking at digital diagnostics, and you might find examples of the AliveCore device, and you can look it up, and it's evidence-based, and you can save it in your personal formulary. Or if you're a clinician, you might prescribe that to your patients. Or if you're interested in solutions around diabetes, you can search for diabetes, things that are therapeutic, things that relate to diet and nutrition, and find a company called Virta that can reverse type 2 diabetes with coaching and diet. So check out Digital.Health. And ideally, we'll start to connect the dots between all this data with our clinical teams and payers. I also, if you interview entrepreneurs, I just launched a early stage venture fund that seeds companies in the digital health space. And we're seeing a lot of incredible innovation, a lot of it coming from people outside of traditional healthcare. The last example I'll give you, and I'll finish, I promise, is 3D printing. That's another area that's gotten very interesting. We even saw examples of 3D printers being used to build ventilators during the early pandemic. So you can 3D print hearing devices, implants. Maybe we want to even think about 3D printing organs. It's kind of hard to 3D print a whole organ, right? People are working on it. And I think we won't need to, because with the convergence of gene therapy, we can now maybe manage the issue of organ transplantation in different ways. The ability now to knock in human genes and knock out pig genes into pigs is enabling us to do xenograft transplants. So you might be on a wait list for an organ, and it might not be kosher, but you'll take that organ from the humanized pig rather than wait for the alternative. And the last example I'll give you is one that I've been working on, is the idea of using 3D printing to address a big problem, which is that of taking too many pills. You might know the average 70-year-old takes 7 or more pills a day. We're not often picking the right drugs or doses and combinations, so I've been developing a way to sort of build a personalized polypill. So instead of taking a pile of pills in a pill bottle, we'll 3D print your own personalized pill. This one's a little smushed, but the idea is that you can make a personalized medication that has your doses and the right combination for you. Could be for longevity, it could be for managing high blood pressure and heart disease. That might be, sorting marbles, essentially. It's a pretty simple idea. And you might have a printer at your corner pharmacy, or you might eventually have that printer in your home, and using all these new digital tools, it might be measuring you and printing out a new pill each morning based on what you might be needing. So there's a whole TED talk about that you can watch about the future of personalized medicines. And I'll close with the idea that a lot of these things are moving quickly, but unless they can get through clinical trials, it's not going to come to us as patients or as communities. So we need to speed up discovery. And that has been sped up through the pandemic. There's now in this era of connected, virtualized clinical trials. You can all download and become a patient in a trial, or even if you're healthy. So I'd encourage you to become a trialist. I actually got COVID in January of 2021, right before the vaccines came out. And I was doing searches on Google, and then I got a pop-up ad on Facebook. Have you been diagnosed with COVID? And I signed up for a trial, and the drug arrived the next day with an app and a connected blood pressure cuff. And I think it was an effective drug called fluvoxamine, a repurposed drug that seems to help in COVID. So this future of medicine is going to be increasingly crowdsourced. Just think about how we used to drive with paper maps. Can you imagine driving around the Bay Area or New York or any other big city without Google Maps or Waze? What if we could all build a Google or Maps or Waze for our healthcare? We all donated data, but we get some information back, just like what we do when we drive. So I think the future of medicine will be one where we're not just blood donors and organ donors, but we're data donors. And we use that data to inform the whole healthcare ecosystem, kind of building a health Waze. In fact, there's a great company out of Israel called Digital.Health, which is allowing anyone to donate their data and get insights about their own conditions. So just to close, I think the future of health and medicine, whether it's in New Zealand, San Francisco, or Timbuktu, is promising, particularly if you think about not any one technology, but how they come together. If you don't think about where we are in just 2022, which used to be the future, but think like Wayne Gretzky, the famous hockey player, skate to where the puck is going to be in 2025 and 2030 and 2032. And if you have that exponential convergent mindset, we can go from our now, episodic, intermittent, one-size-fits-all sick care that usually happens in the clinic to a future that's much more continuous, personalized, proactive, blended with physical and virtual, much more intelligent and AI enhanced with better outcomes at lower costs with better equity for all. So with that, I encourage you in whatever field not to take incremental steps, but take exponential ones. The future, as I showed you, is already here. It's just not evenly distributed. It's in my pockets or it's here in San Francisco. And so it's our opportunity not to just predict the future of medicine, but to boldly build it collaboratively together. So with that, let's bring us to what's next, and let's build the future of medicine in ways that we can only imagine are possible. Thank you. Sorry I talk so fast.
Thank you so much, Daniel. It was awesome to hear where the future is of health and medicine now and in 10 years plus, but also how you're encouraging us all to become exponential thinkers in all areas of our lives. So thank you for that. We do want to open up the floor for a couple of questions. So, yeah, Robbie.
You showed the explosion of different innovations, but at the very beginning, you showed how the hospital board really hasn't changed that much. So there's quite a few barriers in healthcare. Do you think that moving healthcare from the hospital to the home is going to relieve many of those barriers, or are there going to be barriers that we still need to overcome?
Yeah, as I mentioned, technology is great, but the barriers are often cultural. Many cardiologists aren't excited about that virtual angiogram, which is going to cost $1,000 and takes their lunch from what used to be their $6,000 procedure. Sometimes the cardiologists, though, they have a culture of innovation, much more so than the neurologist and the obstetrician. So there's sometimes culture barriers, and often it's the incentive barriers. Many physicians are paid to do more procedures, more biopsies. So that's part of the equation. Some of it's regulatory. The FDA has done a pretty good job of now moving software as a medical device to help some things get approved. But bottom line, it's often driven by the payers. It could be Medicare, it could be NHS, it could be Kaiser. And when you can show that you can take someone and keep them managed at home with their pneumonia instead of admitting them to the hospital where they get other conditions, and it's 10 times cheaper and has twice improved the outcome, that's going to continue to move things into let's say, the hospital-to-home environment. So it's all about incentives and the workflow, because a lot of these technologies, all the gadgets and data flows don't work well with the current horrible electronic medical records. And so epic fail, if any of you guys get that joke. So lots of barriers, but again, tons of opportunities. And some of them happen in other places. So in China, there's an app called Good Doctor. Like 300 million Chinese are now using this app, especially in rural villages. They had almost no care. Now they have a virtual doctor and they can do virtual care, and they don't have perfect medical care, but they have a lot more than they used to. So sometimes things leapfrog. What can happen in Africa or parts of Asia or India is going to be good examples, and then come back to the more developed world.
Amazing.
How do you think Web3 will impact health?
Web3, there's a lot. I think some Web3 speakers and experts are here. There's DAOs, there's blockchain for medical data and clinical trials. There's a lot of opportunities there. I mean, some of us can self-organize our own insurance company. We're all genetic 9s, and we'll avoid being in the same insurance pool, the genetic 2s, and that will integrate with Web3. I mean, the whole ability to build new economies of data and sharing are quite exciting. There's some dystopian elements. I mean, like anything else, AI can be used for good or for bad. Twitter can be used for good or for bad. I have a section I didn't put in here about brain-computer interfaces, but you know Elon Musk has Neuralink, and I think part of the goal there is to be able to tweet from your brain. And unfortunately, he owns Twitter now. So there's lots of dystopian elements, and whether it's Web3 or 3D printing a gun or a pill, you often need to think about the pluses and minuses, and often the ethics and the regulatory is way behind the exponential explosion of technology. So,
one last question.
Is the FDA embracing this in Russian technology? Are they pushing back? What's their mindset?
So the FDA has been smarter than I thought. I know the current FDA commissioner was the one, 2 commissioners or 3 back, and they brought in a lot of experts to look at what's coming, and that's helped them sort of rejigger their regulatory path. This idea of software as a medical device, because it's not just a device anymore, it might have software in it. How do you upgrade that? How do you change the UI on your app? How do you take an imperfect wearable like a Fitbit? It doesn't matter if it's 10% off. It can still tell you whether you're walking a bit more or walking less. Perfection might be the enemy of good. It might depend on what it is. At the same time, they got slammed by COVID, and they weren't very quick on doing rapid diagnostics because they wanted PCR equivalency. And so there's often silos in the regulatory world. But the FDA and some of the Europeans are speeding up. And there's new digital platforms for sharing data, FHIR, and other elements that are improving collaboration and the regulatory environment. But still, that's a huge barrier, because you do want to show that these things work. And there's, just like snake oil in longevity and all sorts of medications, there's some snake oil about digital and other tools. And you want to be sure that they work and that they match the patient and aren't creating a digital divide, right? It might be very different if you're talking to a truck driver in Oklahoma than a Tesla driving, driver here in San Francisco. So I'll stick around through lunch, and I hope to mix it up with all of you. And
we would love that, Daniel. And so if you have more questions, please feel free to ask then. And as a token of our thank you, we have something for you. And I also want to say thank you to Leo for being here and being very patient.
Thanks so much. All right, wow.
Just for Leo's been really following Dan around. So Anthony couldn't be with us. This is from the Olympics.
All right.
This is the Tokyo Olympics. Can't buy this stuff. This is like the AI stuff. So this is from our Olympian Anthony Montier there.
And Leo is a quarter New Zealander. We need to make sure he becomes a citizen too. So we'll work on that. Okay. Thank you. All right.